USMLE Step 3 Flashcards Tapes dorsalis. Tapes dorsalis is present in late neurosyphilis. There is sensory ataxia, means decreased vibration and proprioception. There is lancinating pain. Then neurogenic urinary incontinence and Urgell-Robertson pupil. Urgell-Robertson pupil is it accommodates to light. It accommodates but does not react to light. Next, in all patients with SLE with renal involvement, what is the first thing to do? The first thing to do is a renal biopsy. First step in management of a patient with sudden onset of severe headache, very high blood pressure, and vomiting is a CT head. Which are the drugs, if given, required to decrease the dose of levothyroxine? So glucocorticoids, androgens, anabolic steroids, danazol are the drugs, if given, you need to reduce the dose of levothyroxine. What is the most frequent pattern of renal involvement in SLE? The most frequent pattern of renal involvement in SLE is type 4 diffuse proliferative type. Most severe form of renal involvement can cause hematuria, proteinuria, renal insufficiency, high blood pressure, and hypocomplementemia. And there is an increase in anti-dsDNA. What is the pharmacotherapy for ADHD? The pharmacotherapy for ADHD are methylphenidate, atomoxetine, which is neuroepinephrine reuptake inhibitor, non-stimulant alpha-2 adrenergic agonist, clonidine. So these are the drugs: methylphenidate, atomoxetine, non-stimulant alpha-2 adrenergic agonist, which is clonidine. Next, what is case fatality rate? Case fatality rate is number of deaths from a specific disease or case divided by number of people affected by that disease or case. Crude mortality rate. Crude mortality rate is number of deaths upon total population. How do you monitor disease activity in SLE patients? You monitor disease activity in SLE patients with anti-dsDNA and complement levels. What is the pathology of tapes dorsalis? In tapes dorsalis, there is secondary degeneration of dorsal columns. Next, case-specific mortality rate. So case specific mortality rate is number of deaths from a particular disease or case upon total population, and this is very much different than we studied. Just a second. Then the case fatality rate. So case mortality rate is different than case fatality rate. So case fatality rate and case mortality rate. So case fatality rate is number of deaths from a specific disease upon number of people affected by that disease, and case mortality rate is number of deaths from a particular disease divided by total population. Next, what are Bouchard nodules? Bouchard nodules are swelling of proximal interphalangeal joints which are present in both osteoarthritis and rheumatoid arthritis. So Bouchard nodules are present in both OA and RA, proximal interphalangeal joint swelling. Thank you.